hypertension. Ergo, right here, ERGO. So I got ergo, methorgonavine. This is methergine, but you'll see it as methorgonavine only after delivery. What places a woman at risk for postpartum hemorrhage? So the number one complication with deliveries is hemorrhage. So that's why they're going to give you those clues that post-procedure or post-delivery, your complication, how would you recognize it? How many pads they're going through, their blood or their pulse going up, their blood pressure going down. But I really want to recognize it with that pulse going up, that I suspect that they're having hemorrhage. You might see boggy uterus. You may have a laceration in that cervix or somewhere else in that vaginal area. Impaired maternal clotting. This can happen with precipitous deliveries. Retained placental fragments. This can all set my patient up for postpartum hemorrhage. So we would think about giving them methorgonavine. Antineoplastic, immunosuppressant. So we just talked about this one. It is for autoimmune disorders. Rheumatoid arthritis is an autoimmune disorder. Cancer, psoriasis, autoimmune. Crohn's, autoimmune. Again, GI. Again, it's nausea. It makes them feel bad, but it's not going to get them in trouble. Elevated LFTs, look at their ALT and their AST, their liver enzymes. Fatigue, because it knocked out their red blood cells. So they're fatigued. Methotrexate. Oncology medications. Last time they did the NCLEX, they think, okay, oncology has become a specialty. Yes, they're going to give you a few oncology medications, but basically, when you're watching your patient, what would you watch for? So if you see if it's an oncology medication, think, are they asking about my bone marrow? What would happen if their red cells went down, the white cells went down, the platelets went down? How can I keep my patients safe and make sure that they're being able to be safely taken care of? So how does it improve the symptoms of RA? Immunosuppression. Yeah, those immunosuppressants. But think about the problems when it knocks out their bone marrow. What would you do for your patient? Neutropenic precautions, bleeding precautions, fatigue. Give them permission to rest. Put them to bed. Cluster your activities. Energy conservation. Anticonvulsant by class. This one is for partial seizures, as per definition. Neuropathic pain. This one worked well for that. But again, it works in the brain. This one works in the brain. So there's my drowsiness, my dizziness, my fatigue. Kind of knocks me out. Kind of gets me slow. Gabapentin. GABA. Anytime you see GABA, think, ooh, anti-seizure, anticonvulsant. Because there's another one in this class that's called pregabalin. It's for the same things. It's a partial seizures, neuropathies, fibromyalgia, some of those. So put those things together. Give yourselves a chance to be able to break down that medication and get the answer that you're looking for. Why is gabapentin most effective 3 times a day? Well, probably it's most effective because of its half-life. Your half-life on your medications is a clue. That's your pharmacokinetics that you think about. Okay, is it wearing off that point? Yes, this one wears off because it peaks out in 2 to 3 hours. So you have to tell your patient, you've got to take your medication on schedule and keep that schedule for it to be effective like you want it. Okay, organic nitrate. We're just going to do one more and then we're going to quit and then do some answers. Angina, by definition, yeah. Headache, you know what's coming. Headache, yeah, because it's a potent vasodilator. Whew. You ever seen the little cartoon, the guy sitting in front of the doctor and he says, well, I think we're going to have to change your nitroglycerin tabs or do something. It shows a little man sitting there, or the figurine, his head's blowed off. Yeah. Hypotension, potent vasodilator. flow times resistance. Did I decrease the resistance? I decreased your blood pressure. Tachycardia, because your body thinks you've gone into shock because you've parked all that blood in the periphery somewhere. Nitroglycerin. Yes. What safety precautions should the nurse implement? Because you can get this stuff on your hands. Yes, so you got to be careful. But the patient, fall risk, vasodilation causes dizziness. So you're not going to give them nitroglycerin when they're standing up. Sometimes you're not going to give it to them even sitting down. You want them flat out. You want them lying down to give them this medication. But the safety precautions for you, because this can get on your hands, the ointment, always have gloves on. The spray, be careful, don't get it in your nose, or you'll be the little man that's got his head blown off. And you're thinking, man, I got to get rid of this headache. Okay, we're going to stop right here. Any questions? Any comments? Is it bringing some things that you thought maybe have got hidden in the recesses of your brain? Oh, yeah. Can we see matching 3 again? Sure. We can go up here. But we will finish it. Like I said, we're going to go. And we're going to go over medications with each of our classes, with each of our subjects. Mental health. They got some really dandy medications in that lecture. I don't call them lectures. We're just sitting here talking. We're just having a decent conversation in that. But yeah. So again, like I said, anytime you see these medications, you're not sure. See if you can break it down. We're going to do pharmacology here in a little bit. Pharmacology has suffixes. All prills are ACE inhibitors. All what? SONEs, SOLONEs, glucocorticoids. So we're going to go over these suffixes as we go. But there's also inside, remember, pregabalin, the GABA's in the middle, but it's still an anticonvulsant. TROP. You see TROP in the middle of a medication. Atropine, benzotropine, tiotropium bromide. Sure. Yeah, we will get that with that. We'll come back there. But just think about how, but let me give you another hint for generics. We may even get to that before we leave. Generics is, you've got the suffixes, you've got the middle in those. You need to see, if you see a medication, you've tried to break it down, you have no clue what it is, read the bulk of your question. Does it say why they're given the medication? If it says why they're given the medication, then it can give you a clue what that medicine does or what it's for. But then also, if you don't find it's for lymphoma or it's for this or for that, look in your options. In your options, look for a risk issue, a safety issue in that. Okay. Hyponatremia will have a decreased urine-specific gravity because you've got more what? Water. You've got more water on board, and when you get more water on board, your urine, your kidneys try to get rid of it. So your specific gravity goes down when you are overhydrated, when your urine is overhydrated. It measures solid particles. Specific gravity measures the solid particles in that urine. So if I got a lot of solid particles in that urine, my specific gravity goes up. The manometer stays. It's like a ship on the ocean. It's real salty, so the ship rides higher because it's buoyancy. That's what that urine-specific gravity monitor looks at. But it goes lower when I don't have enough solid particles in it. Only due to fluid because, again, you've diluted your sodium. Yeah. But you got to know what the cause is. What's the cause of that hyponatremia? But yeah, hyponatremia is because I got too much fluid on board rather than sodium. Okay, let's take a break.